Are you seeing the full picture of patient risk? It's never too soon to identify hidden risk of heart disease and stroke for your patients. MD Heart Pro makes it easy to diagnose and manage cardiovascular disease. The 50-year-old lipid panel misses 3 of the most common disorders contributing to cardiovascular disease and offers no assessment of stroke. 50% of patients with heart disease have no traditional risk markers. Most cardiovascular events are due to plaque rupture. In fact, 60% of patients having heart attacks or strokes have normal lipid levels. Cardiovascular risk testing has evolved over time. For 30 years, total cholesterol was the sole metric used to assess risk. By 1980, the lipid panel was introduced, and a decade later, lipoprotein particle size and number were segmented. In the 2000s, inflammatory markers, genetic markers, and metabolic syndrome increased the accuracy for assessing patient risk, as has new inflammatory markers introduced in the past decade, such as insulin levels and triglycerides. MD Heart Pro includes all of these tests, including those causing plaque formation and inflammation, giving you the full picture of your patient's risk for cardiovascular disease. New research shows that atherosclerosis may be a chronic inflammatory disease, and the best treatment is to reduce inflammation to normal levels. LDL-C and/or total cholesterol account for only 25% of the risk of premature cardiovascular disease. As an example, this 46-year-old asymptomatic, non-smoking female would appear to be in a low risk for cardiovascular disease based upon their lipid panel. However, MD Heart Pro tells the rest of the story, identifying key inflammatory and other advanced risk markers that actually put them in a high-risk category for cardiovascular disease. With the power of data, this patient's physician can provide a targeted treatment plan, mitigating the risk of cardiovascular disease for this patient.